Sounds great. Thank you so much for having me today. So again, my name is Marlie. I work with the Adolescent and Young Adult program. We call ourselves the AYA program because it's much shorter. And I work with a whole team really who has a strong interest in supporting young patients at Princess Margaret between the age of 18 to 39, because we know that the way that cancer impacts life at this stage of life is very unique. And there's lots of things to consider sort of outside the confines of the hospital to make sure that they're managing life as best as possible while they receive their treatments and beyond into survivorship and monitoring. And so there's lots of different unique areas and domains, as we call them, within our program that we address. Most often, I do meet my patients at the beginning of their diagnosis. Really, the second time that they meet their oncology team, they will get referred to me to talk about fertility preservation. Now, I'm wondering if any of you have encountered, fertility conversation, with your children as they were being diagnosed. Was that something that was talked about with you and your children? If anyone feels comfortable. Yeah. Okay, great. Good. So the truth is that it's something that, we at the pediatric center are not very consistent at. And that's something that we're really working on. At Princess Margaret, it's becoming more of the standard of care because I'm there to provide that counseling for patients referred to me. And so really the counseling consists of, and really it's the guidelines actually, that all patients are entitled to receiving information about how their treatment might potentially impact their fertility. Information is the key. Even if they are not able safely to have fertility preservation options actually go forward, it's important for them to know about the potential for impact. And so that's a conversation that I have with all of my patients. And if deemed medically appropriate, meaning they're clinically stable, then we go forward with actually referring them to the fertility clinic for sperm banking or egg retrieval. Now, of course, if some of your children were diagnosed, if they were before puberty, the options actually for preserving fertility are more limited, meaning it would require either ovarian tissue extraction or testicular extraction of a biopsy or tissue. And so that's not done greatly, but what we definitely offer for patients who have had pediatric cancer treatment is a post-treatment analysis. So if you or your children are interested in pursuing this, absolutely, you can reach out to me and I'm happy to facilitate this. What that really consists of is for those who are biologically male, we generally say we'd like them to wait about 6 to 12 months after treatment so that they can allow their body to go through about 3 sperm regeneration cycles, and then they would produce a sample, have it analyzed, and really we would generate a report to say they have sperm in their sample or they don't. If they don't at that point, we usually say, let's wait another 6 months and try. And if there's still no sperm in the sample, then we refer them to a male infertility specialist. And that's really when the sperm banking comes into play as a good insurance plan to fall back on. For those that are biologically female, we offer baseline fertility investigations, which consists of blood work, looking at some hormones, a transvaginal ultrasound, and then really a referral to a fertility clinic to talk about options moving forward as well. So that's sort of the whole gamut of fertility conversations that we offer for our patients. I also will talk about, patients who are in school, in university, or for your children, maybe transitioning into university. I always want them to make sure that there are accommodations set up in place, that they've connected with their, dean or principal or whomever to make sure that all the documentation is up to par, so that if they reach out saying, I'm just not feeling well enough to make this timeline, or I need an extension, or I need extra time on some of my exams, that it's not a surprise for them and that they already know this is coming and they can definitely set your kids up for success. It's really important to be proactive for things like that. I also talk about a lot of the time, if patients have cognitive impacts after treatment, if they're having, brain fog, issues with memory or processing speed, things like that, we have a wonderful program at Princess Margaret called the Cancer Rehab and Survivorship program, where it really, they do a brain fog assessment. They will provide brain fog resources, which effectively work to train your brain to think a certain way and prime the brain a certain way to really prepare to function in, school or whatever career choice they go into. We are actually also in the process of hiring a vocational counselor. So for those who are graduating high school and thinking about next steps and how to navigate that, or for our younger patients who have graduated university, who are sort of trying to think about careers, or for, even a little bit older who already had a career and are now starting to question if that's the path they want to continue down after their treatment, this is exactly what this counselor will be there for. So if you feel that your child would benefit from that, absolutely, we can connect them to this professional once they're hired. The posting is actually live right now. I also talk about, time off work, and, if there's some of your kids are starting to go back to work and they feel that they need a more gradual return to work process so that they're not diving headfirst into a full workload. We know that it's easier to work themselves up and to sort of see progress that way. It feels much nicer than having to peel back layers. And so I work with a lot of patients to make sure that they're transitioning back into the workforce in a way that seems manageable for them. I also will talk about, connecting them to different young patients. At Sick Kids, it's nice that everybody on the ward are kids. They might not, though, connect with people who are around the same age as them. And we know there's that teen lounge and the clinic side at Sick Kids, which is really nice to connect with other young patients. But another way that they connect is through our program. And specifically for your kids who are transitioning over to adult care, they will definitely notice that most of the patients there are much, much older than them. And that can definitely feel quite isolating, which is why I always stress to all of my patients when I do my intake that it's so, so important to feel that sense of community and to really look around at everyone in the virtual setting or in our event setting, which I'll get to in a moment, to really just look around and say, I'm not the only one going through this. It's super, super powerful to have that sense of connection. And so we offer them a couple of different opportunities to connect with other young patients. We have amazing, amazing organizations in the community. And we can, Sarai can definitely send these out to you as well. Gilda's Club, Wellspring, Young Adult Cancer Canada, Cancer Dudes for those who identify as male, and Pink Pearl for those who identify as female. Stupid Cancer is in the US. All of these are actually doing virtual program right now. So it's really, really easy to and very accessible for everybody to attend, even if they're not feeling well or if they're, immunocompromised and don't feel comfortable to join in person. There's lots of options available there. Each of these organizations have different support opportunities. So Gilda's Club, for example, has a 20s and 30s support group. They do accept, patients who are a little bit older and a little bit younger if they feel that they would benefit from these group programs, and it's 8 consecutive weeks. Wellspring has disease-specific support groups. So for patients with leukemia, they all meet together, all ages, of course, but it's nice to connect with people who understand the treatment process and the protocols and things like that. Those are different support options, but it's important for you as parents to also know that there are lots of caregiver options. If you haven't connected with Wellspring or Gilda's Club yet, I highly, highly recommend that you do so. Being a caregiver is, one of the most rewarding and challenging roles that you will ever have. And so it's really important that you take care of yourself as well. So I would definitely recommend those for you. Now, those are the community organizations, but within our AYA program, I also offer meetup sessions as well. So once a month, we have either virtual sessions or now we've just restarted in-person events. So the virtual sessions are on Microsoft Teams. They're about an hour and a half in length. And it's just, I always offer for patients and attendees to keep their cameras off, like some of you are doing, to use an alias name as well, just to increase their comfort. But for those who are comfortable speaking, I always encourage them, write down some questions that you might have. think about sort of asking your peers how they've managed some concerns that you're having, because I can, of course, give advice that I've learned over my experience in this role and from speaking with patients, but it's so much more impactful coming from patients who have gone through the same thing themselves. And so it's a great opportunity to just share experiences and feel that sense of support. The in-person events, we are so excited to bring these back as well. They haven't been active since long before COVID, actually, due to turnover in my role, and now they're back. So we're trying to do one every season, just to really offer different opportunities for patients to join and meet. So we had one in August, and actually our youngest attendee was 18. And it was just an opportunity to play lawn games like spike ball and cornhole, and we had subs, and then there were different organizations that we had booths for to explain different programs. And then, of course, we had an in-person meetup style discussion where they just asked some questions. We did a journal reflection, some mindfulness activities and things like that. And our next one is actually happening on October 23rd. It's going to be in High Park. We're just going to buy everyone sort of a warm beverage and to go for a nice walk with the fall colors. Hopefully the weather will be nice, and we're going to sit on some blankets and have just a meetup style discussion in person as well. If you think that your child would, love to join, they are more than welcome. You can just reach out to our program, and our email, Sarai will give that to you as well, is aya@uhn.ca. So these are the different support options. I also do a lot of teaching, for patients who are on active treatment about how to maintain movement. Exercise is medicine. It is so important for mental health and coping and prognosis. And of course, just for mobility. Of course, if they're sitting still for much longer, they might experience muscle deconditioning or muscle wasting, stiffness, things like that. And so I do a lot of coaching and connect them to physiotherapy, or there's kinesiologists that work at Princess Margaret that will do sort of a whole body assessment, see what their areas of concerns are, and prescribe exercises to them. I also think, for kids that are transitioning over after treatment, trying to help them sort of rebuild. Body image is such an important thing to consider at this stage of life in terms of what sort of physical changes did they notice from treatment, scars, hair loss, muscle wasting, maybe their skin color has changed after a bone marrow transplant, for example, things like that, and how to do sort of body image coaching. I do a lot of that, and also sort of refer them to specialists to help rebuild muscle and sort of focus on rebuilding their strength and capacity so that they can do the things that are most important to them. Maybe get back into hockey, maybe get back into rock climbing or gymnastics or whatever it is they were doing before. How do we help them achieve their goals and get back to where they wanted to be? I do a lot of coaching on, sleep and sleep concerns, and really making different recommendations for mindfulness and journaling to really help them settle down before sleep. I also do a lot of teaching. This is where, you as parents are always welcome to join the calls for us, but I do actually ask parents to step out for the time that I talk about, body image and sexual health. Sexual health, whether we want to believe it or not, is something that's on everybody's minds. And it's really, really important to talk about how, the cancer experience might have impacted their sexual health and sexual function and ability to connect with others. A lot of young patients have a lot of anxiety in terms of, navigating dating after a cancer experience, how to disclose that they had cancer at all, how to talk about that they're going through cancer treatment, that they might not be able to, get an erection or things like that. And yes, I will talk about this with your kids because I need them to know that these sexual dysfunctions are common, but are, something that we can definitely help them out with. And it can cause a significant amount of stress if this is not talked about. And studies have really shown that as well. And then, of course, we talk about, coping and connecting your children to mental health supports as needed. I'm not a therapist. I am a nurse by background. So I do a lot of sort of talk-based therapy and reframing, but if they need more intensive therapy and counseling, then there are supports available. I will say, though, that the mental health support at Princess Margaret is largely for patients who are on active therapy. If they are outside of a 3-year range from their or from their end of treatment, rather, they are not eligible for the mental health supports at Princess Margaret. This is a big gap, actually, and something that we struggle with as well. Even the patients on active therapy, the wait time is very, very large. And so it's important for patients to know that if they have anxiety, it's important to talk about it with somebody, either yourselves as their parents, their healthcare team, me, and we can find a place for them. Most likely it will be in the community, finding a therapist in the community. Most of them are not covered by OHIP unless you find, a psychiatrist, for example, but there will be an out-of-pocket expense for that. But of course, it's an investment in, child's well-being and mental health, and it's very, very important. Oh, yes, I have a question in the chat box. What therapies would be available to patients treated at McMaster Children? That's a very, very good question. I'm not too familiar with McMaster Children. I've only ever worked actually at Sick Kids and Princess Margaret. But for questions like that, you should definitely ask the pediatric oncologist to see if they have mental health supports as well. I'm imagining that they might have something along the lines of adolescent medicine. That's what is available at Sick Kids. It's called the Adolescent Medicine Team. They do therapy and things like that with the patients at Sick Kids. There must be something similar to that at McMaster Children. So I would encourage you to reach out to your primary team about that. Are you able to refer to CAMH? So yes and no. It sort of depends what the main concerns are. CAMH definitely specializes in a lot of addictions and mental health concerns, such as, severe depression, schizophrenia, things like that. So that might be an option available, but again, their wait times are quite long. So it's something we can definitely explore on a case-by-case basis, but usually and generally speaking, I do refer to the community because private practices are generally much faster to get in. Whereas if you refer through the hospital system, they could be waiting for about 6 to 9 months potentially for a consultation. I have a patient recently that we referred to Women's College for a trauma-based program. And the bottom line is that she has been on a wait list for a very, very long time, and it's quite distressing to have a mental health concern and not be able to address it in a timely manner. This is actually a healthcare system issue where mental health services are just not as readily available as we need them to be. So definitely can refer to CAMH, but we can explore other options as well, for sure. Any other questions about mental health supports right now?
Marlie, I had a question from a parent that was submitted in advance, and it kind of has to do with mental health. So the question says, my daughter moved to adult care before COVID. She has experienced difficulties navigating through this new system, including the role of each specialist assigned. This change has caused her a lot of anxiety. None of her doctors seem to listen to her when she speaks. She feels each appointment is a waste of time. Are there any suggestions on how to approach this, and what's the best way to have her referred to address her anxiety? Which is kind of what you were talking about.
Yeah, thank you for that question. Yes, definitely the transition over, and this is sort of where I want to take the conversation from now on, is transitioning over causes a lot of anxiety. As you know, in pediatric centers, there's a lot of different models available. And I'll speak to Sick Kids just because that's the one I'm familiar with. But at Sick Kids, and they have a contact nurse that you can email all the time and schedule the appointments. And they're always sort of a point of care contact person. And I know there's something, I believe there's something similar at McMaster as well, where there's just a designated person that you can always go to. They do exist, but definitely, the amount of support and hand-holding that does not exist in adult care necessarily. And so the transition piece really is transitioning to being your own advocate as a patient. So whereas maybe as parents, you were the one sort of coordinating the care and advocating for your child, and you were the one communicating with the oncology team about concerns, And in the adult care world, it's sort of an expectation that the child, or the patient rather, themselves is the advocate and is the point of contact with the primary team. And so that causes a lot of anxiety, sort of making that switch. And it might cause some anxiety for parents as well, where we actually address the patient directly rather than the parent themselves. So it's a matter of sort of preparing your child for, okay, you're going to the adult care world now, and this means it's time for you to take ownership in your own healthcare. I will be here to support you along the way. Your team will be here to support you along the way, but it's now time for you to advocate for yourself and tell your team what it is that you need. I'm here to back you up anytime. And I also want you to tell your children that I'm also here. I have worked with a lot of patients who are transitioning over, and I'll tell you what that looks like. If you know, again, this is specifically for sick kids, I'll go over and I'll actually meet patients in person and do my initial consultation in person because it's just across the street. But if a patient is transitioning from McMaster to Princess Margaret, for example, I would be happy to do an initial consultation even before the transition over. I also always offer, if patients are interested, I would love to give a tour of Princess Margaret. I will meet at the front door. I'll give a tour of, oh, here's where Tim's is. This is where you can get all of the patient education pamphlets. This is where your oncology appointments are going to be. This is where you'll get your blood work drawn. This is where my office is if you ever want to come say hi. And so I always offer that as an opportunity just to kind of get people comfortable with the new physical environment. I also try to show up on the first day of the clinic appointment. Again, if this is something that you and your child want, I'm happy to come and sit in as part of, you know, the first conversation with the oncology team that you'll be meeting at the adult hospital. And really just to kind of say, you know, this is my colleague. I work very closely with them. You're in very, very good hands. And I'm also here to support you as needed. So that's sort of the gamut of support that I offer to help sort of ease the transition, introduce people to everybody, all the key players, and sort of make them feel a little bit more comfortable. And then again, like most places in the adult world, we sort of leave it up to your child to reach out to us and to the team for any concerns at all. I always make it very clear what the concerns are that your child should be reaching out to. So if they have questions about navigating friendships, or how do I see friends safely if I'm immunocompromised given the COVID pandemic, or I'm having really bad body dysmorphia, like help me coach through that. And so it's up to them to reach out to me. And that's sort of the main difference between pediatric and adult care. With regards to that second point of the question about anxiety and, you know, referring them to anxiety services, again, I kind of touched on that, but it's a good idea for us to have an initial conversation, because sometimes just meeting me to talk about all of the different areas just helps them feel validated. And maybe sometimes that's all they need, is just validation that what they're experiencing is really normal, but these are the resources. This is how I can help support them. If they need additional services, you know, for anxiety specifically, again, case by case basis, we'll find the right avenue for them. Does that answer that question? If you're on the call, is there any additional questions you had about that?
I think that's good. Thank you.
Perfect. Great. Thank you. Okay, awesome. Great. So there was also, there was another question, Sarai, about sort of the list of specialists and all the people involved in their care. Goodness.
Oh, sorry. The question was, they're finding it difficult to find a doctor for their son as the son turns 18 years old. His pediatrician has no recommendations. After we ask for any referrals or assistance in finding a new doctor, what would be your advice in going about this?
Okay, great question. Thank you. So it kind of depends. The bottom line is, if your child is going to a post-secondary education, a lot of the time they have student clinics available. So for example, I went to Queen's University. They had a student general practitioner like practice, and I was seen by the same physician for my 4 years at Queen's, for example. So that might be available depending on which institution your child is going to. Generally speaking, though, the main way to get in touch with a physician after they transition out of pediatrics care is through Google, and actually just calling different family practices and saying, hi, I'm looking for a care for, myself and my child. Are you accepting patients? And then really, I would definitely advise that you actually conduct an interview with, actually interview the physician and make sure that it's a good fit. Say, these are my concerns. This is their health status. They were treated for a sarcoma. And so I will want, are you comfortable, doing monitoring, yearly checkups? Really, I want you to think about, reflecting on what it is that you're looking for a GP, and does this person actually tick all the boxes for you? And then if they don't, then that's okay. You don't need to settle for them. Just look for somebody else as well. But generally speaking, Google is the way that people go, and then call the clinic, see if they're accepting patients, and then organize an initial meeting just to see if it's a good fit. If it's not, it's okay. There are more, but I will say, please don't get discouraged if some clinics that you initially contact are not accepting patients. You just have to keep looking. But unfortunately, sometimes pediatricians aren't aware of how to transition, and neither are we at hospitals as well. We're not really aware of what's in the community. So it does sort of go back to the family to seek that out on their own time. Does that answer that question?
Yes, and I just wanted to ask too, when you get a doctor or you're looking for a doctor, I mean, is it important that that doctor have knowledge or I guess abilities in oncology? I mean, it's not, I don't know if every pediatrician would have the same amount of knowledge in that area. So I'm just curious about that too. What should we focus on what our child went through and just sort of say, is this something you're familiar with, or do you have any background in this? Or, cancers change too. It doesn't mean that that's going to come up, but I'm just curious that, I know you said make your questions relevant to your child's case, or what you're really looking for, what your child may be looking for, who is now an adult, but I'm just curious about what you would add to that.
Yeah, thank you for that. It's an important thing to consider. It sort of depends how far out your child is from treatment. If they're, let's say 5 years out of treatment, then we actually do discharge them from oncology follow-up to a general practitioner, in which case it's important for them to know that your child went through a cancer experience. For, if there's any sort of long-term monitoring that needs to be done, like heart monitoring, stuff like that. Hopefully, and I would encourage you to ask for this from your team, they should write down what chemotherapy agents your child has received, such as doxorubicin, daunorubicin. Those are known to cause, cardiac issues, cardiomyopathies, we call them. And so sometimes they need some long-term screening, like echocardiograms every now and again. I'm not actually sure what the guidelines are in terms of how frequent they need it. But make sure that you ask from your oncology team to get sort of a list of agents, so that if you do give it to your physician, you can say they did get agents that can cause lung issues or could cause heart issues. How do we sort of monitor that moving forward? So it's good for you to have an understanding of sort of what your child was exposed to. They don't necessarily need oncology background, but it would be helpful for them to know what your child was exposed to and what sort of things they should be looking out for. You can also ask that they connect with the oncology team. That is a fair thing to ask. If you feel more comfortable, just to say, hey, I know my child is 5 years out of treatment, but I am transitioning back to GP. Are you okay to just have a quick touch base? Or can you maybe send them an email with some things that they might need to consider for monitoring moving forward? That's a fair ask, and I would encourage that actually.
That's a great point. Thank you. That last point. Thank you.
Yeah, you're welcome. It's kind of, it's hard, right? When there's so many transitions and you're jumping between different cases. So it's, again, just informing yourself so that you can advocate for your child as well, for sure. Yeah. And it's reasonable to add, like I've connected with different physicians as well, just to kind of talk about exposures and how they had chest radiation, and they're at risk of developing a secondary cancer because of that, for example. So I've given that information as well.
Thank you.
You're welcome.
Marlie, there was one other question I had in advance, And it said, is it common for kids to stop yearly checks after the 5-year mark? They mentioned that my son will have his last MRI before his 5-year post-treatment date.
Yes. Great question. Oh, I know this is an interesting one because it just doesn't feel good to say, okay, I've been monitored so closely for this 5-year period, and now you're saying we don't need annual checkups anymore. That is practice. That is the general standard of practice. Where once they've hit the 5-year, for some reason, and there are reasons, I'm just not familiar with why they chose a 5-year cutoff, but once they are, cancer free in remission for 5 years, we say that they are cancer free. And at that point, they don't need oncology monitoring anymore, which is why they're discharged to a family practice. So at that point, with your general practitioner, you can still schedule, routine check-ins once a year, like a physical assessment and blood work, maybe if they feel that, your child needs it. But the bottom line is that they are not considered an oncology patient anymore, which is great news. But now it's just a matter of transitioning out of that cancer mindset into just normal life mindset. It's okay if they get aches and pains. It's not their cancer. It's okay if they get bruises. It's not leukemia. It's okay if they have a cough. It's not lung cancer. This is a very, very hard mindset to adapt after being in cancer mode, as I call it, for so many years. But it is something that you have to, really, really work on and practice, because it will take time to kind of switch out of that mindset. But your child is just considered just regular old child, no longer a cancer patient. So yes, it is common after the 5-year mark to not have yearly checkups anymore.
There's a question there in the chat kind of related to that, Marlie. It says, our daughter will be followed for life at McMaster's aftercare so long as she wished to go. I noticed you said patients are discharged to a general practitioner after 5 years. Does this depend on trials, type of cancer, etc.?
Yes, absolutely. And it depends on the clinic structure, really. So the the aftercare program at McMaster, that's amazing. They have a pediatric aftercare program at sick kids, but then they will transition them over to the adult aftercare program, for example. There's specific eligibility criteria. It's all sort of nuances, but the long story short, the aftercare clinic at Princess Margaret is not built to monitor for relapse. So they will potentially be, referred over to the bone marrow team for monitoring until they are 3 years post-treatment. And then they will transition over to the aftercare program for monitoring for another, year or 2 years, or whenever they meet the discharge criteria is the bottom line. So if they are on, a clinical trial and there's known long-term effects, or we don't know the long-term effects, or if they had, transplant and they're having graft versus host disease, it sort of depends, but they'll need to sort of meet the discharge criteria and they also, you and your child have to feel that it's safe to be discharged as well. You might not feel ready to be discharged from oncology care, but they won't discharge you unless they are very, very confident that you are safe and that your child is safe and that it's a safe decision to make moving forward. Caroline, you mentioned depends on diagnosis. Yes. So it just, as I mentioned, it sort of depends on your child's case and sort of what sort of side effects they're going through, long-term effects, things like that. But they will always discharge when it's safe to do so. It just also depends on sort of the clinic structure. I know at Princess Margaret, that's how it's structured, just because of capacity. There's so many patients there. Oh, take care. Okay, awesome. Any other questions about that stuff before I move forward with some of the other things I wanted to talk about today? Okay. So yes, expectations. I wanted to talk a little bit more about expectations. So, preparing your child to empower them to be their own advocate, and then preparing yourself to take on more of a support role. Does anyone have questions about sort of how to prepare your child for this? Anything that your child has been asking or that you've been wondering about what that actually looks like?
Marlie, I was still thinking Carolyn was leaving. Marlie, I guess that question would be, what are the differences specifically between the adult cancer care and sick kids? Like you mentioned, for example, before, you won't have that one point person to go to all the time. Like, what are specific differences that you have, or that, you know, are there just the differences that they don't have with sick kids that you do, or vice versa?
Great question. So, for example, at pediatric institutions, you might have one contact person, like a contact nurse who coordinates the clinics and everything like that. Rather, at, Princess Margaret, for example, they have a list, it's a triage nursing line. So you would call the leukemia nursing team, and somebody will either answer the call right away or will call you back within 4 hours. So it's not immediate, because you have to think of it this way: the amount of patients at an adult institution is exponentially higher than at a pediatric institution. We're very lucky that, there's not many pediatric cancer patients, but, there are many, many adult cancer patients. And so just from a capacity standpoint, they won't be able to answer your concerns unless they are urgent very, very quickly. So they do say within a 4-hour window, they should call you back. And there is a clinic line. And so, sorry, going back to that, for the triage nursing line, you won't speak to the same person every time as well. So that's something to keep in mind. They will always liaise with the oncology team if there's somebody on call to kind of talk about a plan, and will always call you back. But the other thing to note is there is an after hours line called CarePath. And CarePath is how you contact, it's a specialized oncology team as well after hours. So after 5 p.m. Monday to Friday and on weekends. And then you would call them in the same process as well. They would get back to you within a 4-hour period. So it's not one contact person, it's a contact team rather. So the continuity might not be there the same way. And so it's important that you and your child knows that, even if they're not speaking with the same person every single time, that everybody cares for them just the same. And it's a team effort. So that's just a little bit of a different structure. It's also important to know that if, there's any emergencies, Princess Margaret does not actually have an emerge. I don't know if you're aware of that. I just found that out when I started in my role about a year ago. But the emerge that we usually send patients to is Toronto General, and they are still in the University Health Network. So we have access to their files and things like that. But that's just something else to consider. If you're ever worried and you don't hear fast enough, just go to emerge. It's much easier than, waiting for somebody to call you back if you're really, really worried. So I would say that's generally speaking the main difference. The other main difference is that they're going to be the youngest people there, and that can feel really isolating and intimidating. So it's really, really important for them to just voice that to somebody. Reach out, connect with other young patients. Come to me, we'll talk it out. There's just ways for them to feel supported. But I would say that's generally speaking the other sort of scary thing about coming to the adult world is there's a lot of old people, and that can feel quite intimidating. And also, some of the care providers might not feel as comfortable caring for young patients because they care mostly for old patients. So their approach is not as, warm necessarily and loving and handholdy as you might be used to in a pediatric institution. They might sort of come across a little bit more cold sometimes. And even I find that, coming from a pediatric background, moving to the adult care, that doesn't mean that they care any less, though. That is just their general approach. They're just trained differently. So I would say those are, generally speaking, the main differences. But does anybody have any questions about any of that?
There were a couple of questions in the chat there. Fanyun wants to know, where can I have this kind of information? Do you have it on the website?
Yes, so we do have an AYA website. So Sarai, maybe after this, we can generate a list of resources that I've mentioned, and then we will definitely send that out as well. So we do have, if you Google AYA PMH, then we have our AYA website. There's lots of different resources, publications. If you're interested in learning more, you can see who our team is, things like that. And then really, there's lots of different community organizations that will also generate on that same email if you wanted to reach out to them and try to connect for support or different programs like yoga, cooking classes, art therapy, all through those organizations for free. So we'll definitely send that out.
Thank you, Marlie. Thank
So-
you very much.
You're
Can I have one more question?
Of course.
Yes, because my son just moved from CKs to Prince Margaret this year. He is 18. He's a leukemia survivor,
Okay.
and he went to University of Toronto at Mississauga. So he's very excited about the everything. But my before, like, we have this hand holding of him going through everything, and we are very thankful to the CK's professional nurses and doctors. But right now I'm in the transition, so I'm not sure how can I encourage him to take care of his in the adult world, and what kind of support I can have. So I think your presentation is super. So I want to get more contact with you or more information, because when I talk to him about what's going on moving forward, we kind of don't know what else can we have, because like he had this sclerosis, because his body is not very strong. He has to take full courses at UT. So, and the mental health, stress, all kind of things. So I want to learn a little bit from you if possible.
Absolutely.
Thank you.
Absolutely. So I would encourage you, I'll type my email in the chat, and I would encourage you to send me an email, and we can definitely set up an initial consultation. It's usually about an hour in length. You are welcome to join, like I said, for everything except sexual health. And then we can definitely talk about, those mobility concerns and things like that. We can refer either to physio, or we have actually physiatry, who's they're a medical doctor, so they went through medical school and they have training in sort of mobility and orthopedic concerns and things like that. So we can talk about all of these things in our consultation. And then you can also, I do also talk about a lot of, it's up to him now. And you can have, routine check-ins. You don't have to totally, as a parent sort of transitioning, you don't have to totally, wipe your hands clean and say, you're on your own now. For sure not. You can still have check-ins to say, how are you feeling today? Like even just once a week, or, if he's feeling unwell. Is he living with you right now?
No, he actually live on campus.
Okay.
Yeah, but yeah, we talk like almost every day and see how it's going, and he's very excited and want to start a new life. So
Yes. And I want you as a parent to recognize how special that actually is. Although it might feel really nerve-wracking that he's out of your house, he's done cancer treatment, like how do I lay eyes on him the same way? You don't need to, actually. It's time for him to spread his wings and to just be an adult and live his life. Cancer is in the past now. But if it makes you feel more comfortable, you could schedule sort of a check-in with him like once a week to say, hey, how are you feeling? Any concerns? And then he can kind of voice any of concerns to you. Or you can say it this way. You can even say, I'm worried that I don't see you and I don't kind of lay eyes on you to take care of you anymore. Please tell me if you ever have concerns. I will make sure that we connect you to the right person. I will take care of you as needed, but I need you to tell me now that you're an adult. And then you as a parent need to learn to just adjust to that, adjust to the fact that he is an adult and he will come to me if he has concerns. And that actually really empowers him. It might feel really unsettling to you, but you need to trust that he knows what he's doing and that you've raised him really well. And he knows that if he has concerns, he can always come to you or me or his team or somebody. As long as he knows that he has to talk about it with somebody, that's really the most important thing. And then you leave it to him.
Yeah, great point. Thank you so much. I think will work very fine. Thank you.
Absolutely. So we'll talk more if you reach out to me, and we'll have a whole conversation about all the things that I alluded to at the beginning of the talk, and then sort of how to make that transition feel more comfortable for both of you. Absolutely.
Yeah, wonderful. Very appreciative of
My
you.
pleasure. My pleasure. That's what I'm here for. Exactly. Now I'm reading a question about BMT. BMT in 2009, crossed over to adult care in 2019. All appointments since have been mostly by phone call. Expect we will need to go to our family doctor. It's interesting. Would you feel comfortable elaborating a little bit more on that? All appointments have been by phone call. Can we we need to go to our family doctor? Are they transitioning you out of Princess Margaret altogether? I'm just not totally clear. Maybe we can move on. All scheduled appointments have been phone call only. Yep, that's very standard, actually. If they're far out of treatment and there's no concerns anymore, it's very common to do virtual care right now. Absolutely. But if you felt like you wanted, your child to go in for a physical assessment, if you have concerns, you can always request that as well. But very, very common for actually most clinic visits to be by phone or by Microsoft Teams. But you can advocate for an in-person one if you feel like that's necessary. Or Microsoft Teams. I do Teams appointments all the time. I love them. People can do it, in bed. I have some patients talk to me lying down in bed. So it's completely whatever is most comfortable. But if you feel like you'd like to come in person, absolutely. But oncology care can happen at the same time as general practitioner care as well. So if you have concerns that are not cancer or BMT related concerns, but you have concerns that are just related to, hey, when can I restart immunizations or things like that, then you can definitely go to the GP as well. You don't always have to go to your BMT follow-up team anymore.
There's another question here from Sue. What happens to our child's chart once they turn 18? Do we still have access?
I don't know the answer to that. That's a really good question. What if there was something specifically that you wanted access to, you could potentially, ask it kind of depends on the comfort of the clinician. Some people will feel comfortable printing their notes out. I, for example, can't print somebody else's note, of course, but you could ask them if you wanted to print notes and sort of prepare a package. Let's say you're transitioning to the GP, so you can give them, tests or most recent labs or whatever it is that you want to have access to. You can definitely ask that. I see your child can give consent for access to my chart. Sure, that's another possibility. Thank you for sharing that. Great. Any other questions right now before we move on to the other things that I wanted to talk about today? So the bottom line is, I know there's a lot of anxiety sort of moving over, but I want you to know that they are in really good hands, even if the care feels a little bit different than how it felt at Sick Kids, taking under their wing and sort of patting their heads and holding hands. Even if, oncologists have different demeanors or ways about them, they care so much. And I'm saying this with 1,000% confidence because I work with these people and I know how massive their hearts are. They really care, even if they show it a little bit different. And I want you to know that they are in really, really good hands. They are experts in their care. And if you ever have concerns, please voice them. They will listen. And if they don't, then come to, me and I can help advocate as well. I always try to bridge that gap as well. Sometimes helpful to have a little friend like myself on the inside too. Happy to do that. I want to talk about some ways for your children and yourself also to stay connected, with our community. So we actually do have an Instagram and it is AYA program. I'll type that in the chat. On Instagram, you are welcome to follow us. We also have a newsletter that we send out as well. So if you would like to receive our newsletters, or if your child would like to receive our newsletters to see what's happening within our program, and we also share a lot of what's happening in the community organizations as well, please reach out to our email, the aya@uhn.ca email, and just say, hey, I'd like to come on your newsletters. That's a nice way to sort of stay connected with the AYA community as well. Our social media, also, we share lots of things through there. It's good for you to think about, if your child is going to be enrolled in a post-secondary education program. We actually do have a grant through our program called the Michael Kamen Hart Scholarship, and we just granted $1,000 to 13 applicants as well, which is, we really, really care about supporting, continued growth in education. So we do try and grant that to, about 10 applicants per year. So something to keep in mind for next year's school program. Unfortunately, it's closed for the year, but we will be offering it every year as well. But these are sort of things that we share on our social media as well. A reminder that the deadline is this day. Reminder, we're having a virtual meetup happening this week. Just little things like that. It's helpful to stay connected that way. We are also sort of breaking into the TikTok world. I am not, but my lovely admin is, and she's trying to generate some health content that way. So these are different ways to sort of stay connected with what's happening in the community. And the last thing I wanted to talk about is how to get referred to our AYA program. Now, I know I do work at Princess Margaret, but we are the only AYA program in Ontario actually right now. And so I do also support patients who are receiving care at other institutions. I really don't say no. I want them to have access to this type of care because we know it doesn't really exist elsewhere. I know if any of the patients, any of your kids are being cared at Sunnybrook, they are establishing an AYA program currently, but it's not in place right now. And so if you feel that your child would benefit from speaking with me and getting access to some of the resources that we have available, just reach out. I do accept self-referrals. You don't need a referral from the healthcare provider, so you can just email aya@uhn.ca and just request an initial consultation with me, and we'll come up with a good plan from there. So that's the best way to refer. You can get a referral if it's easier through your healthcare team. They can reach out. They know how to reach me too. All of this to say, there are definitely different ways to get in touch with us, and we'd be happy to conduct an initial consultation and make sure that your child and yourself are feeling well supported moving forward. A lot of the time I do connect with patients in the survivorship phase. So post-treatment, when they're sort of learning how to navigate, what does life look like after cancer? How do I switch out of cancer mode into just life mode? And how do I get used to having aches and pains without worrying that it's my cancer coming back? And so that's a lot of the counseling that I do as well. So anytime, wherever your child is at in their cancer trajectory, just come to me and I'm happy to help out. That's really the end of what I wanted to speak about today, but I'd love to open the floor to you for the last 8 minutes or so, just to hear if there's any additional questions or concerns, comments, anything at all that you'd like to ask me.
I think you've answered a lot.
I'm glad.
A lot.
I'm glad. And again, even if your child doesn't want to speak with me, but you just have some questions that you want answered over email, again, please feel free to reach out via that AYA inbox. I check it many, many times a day, so more than welcome. And we can even just communicate through email if that's easier for you. Happy to help support in whatever way that's helpful for you.
You're so helpful.
Well, it's my pleasure. It's really it's a privilege. I obviously feel very strongly about empowering young patients about, being advocates in their care and helping to just support them in any way. So I'm here. Oh gosh, I wish I presented 3 years ago as well, but we're here now and I'm happy to help you all moving forward.
And it's so important to have those resources for adolescents, especially because I've often heard from parents that, there's a lot of supports for the kids, and there's a lot of supports for adults, but for that population, of adolescents, there's not much, right? So this is so valuable to have this.
Yeah, and I'll send you, we'll send out that whole link of the different community organizations. It's definitely a gap where the adolescent young adult population are viewed as an in-between population, not quite kids, not quite adults. And so that's really why our program exists. So like I said, happy to help in any way. It's been an absolute pleasure being here. If there's no other questions, then like I said, you know how to connect with me. Please look out for that email to follow up. But thank you so much for having me today. I have really enjoyed your questions. Thank you so much for coming. And it's been a pleasure and a privilege.
Thank you so much, Marlie, for all your time. And like Marlie said, we'll send out an email with some resources to everybody here who's registered. I'll also post this recording on OPAC social media and YouTube channels so that everybody can watch it again. And just a reminder, OPAC is here to support the parents. And we have drop-ins with our parent liaisons like this, virtual drop-ins every Tuesday at 7:30. And we're here to support you as well. So thank you, everybody, for showing up tonight. Thank you again, Marlie. So wonderful.
My pleasure. Take care, everyone. Good night.
Bye.